Mr. Griffith from Virginia is recognized for 5 minutes.
Mr. Spiegel, how many claims does CMS get a day? You know?
I don't.
And but it would be millions, would it not?
It would.
And do you have any idea what percentage of them you're able to review before payment is made?
Well, we do a substantial amount of review on virtually all of them before they get paid.
Okay. And I saw somewhere, I know that there was some testimony earlier that there was some indication that we didn't really know what the private sector's rate was, but I had seen somewhere or have information that their rate is about 1.5% loss to fraud. And I'm just wondering if you have seen that, A, and B, if you have studied what the private sector is doing to eliminate fraud, so you can see maybe if there are better ways for eliminating or preventing Medicare fraud.
Sure. I've seen some numbers for the private sector, and we did look into what it is about them that makes them different from us in the way they approach this. So in the private sector, they have a different approach to how they deal with approval of services that we don't do in Medicare, because we're designed as a program to get beneficiaries needed services and not to impose restrictions at the point of service. But private insurance can have prior authorization for a whole range of things that we don't. And so they can eliminate things that may have an impact on someone's need for services, or at least impose a barrier there that we don't operate that way.
Since there appears to be some intent to pay for all of this new health care by getting rid of this fraud, have you all considered going to a pre-approval process?
Well, we've had discussions. We've had discussions about that among ourselves, but right now it's not consistent with, I guess, our statutory authorities to be doing that.
And let me switch. I'm sorry.
If I might point out something else that's a key difference between the private sector and Medicare is that Medicare isn't any willing provider program. So the private sector has much more ability to restrict the providers who are coming into the program than Medicare does. Now, with some of the new authorities in the ACA, CMS is going to have more authority to take a closer look at providers and keep out providers who are not good actors. Let
me claim back my time. Let me ask, switching gears, just something that's kind of interesting. It's my understanding that the Medicare number, and I don't care whether it's Ms. King or Mr. Spiegel, but the Medicare number is the same as your Social Security number. Is that correct?
That is correct.
And then if somebody steals your identity, you can't just go out and change your Social Security number. Wouldn't it be a better policy to have each patient have a separate Medicare number, and then when somebody steals that number, the patient can get a new number just like you do with your credit card if you lose it or it's stolen by somebody?
Certainly there have been proposals made to that effect.
And we're doing a substantial amount of work right now to eliminate all the compromised numbers that we've identified for both providers and suppliers as well as beneficiaries.
So doesn't that have the impact on the one hand of making it very difficult for the patient? And then I guess I would ask, what is your opinion of that? You said that it had been talked about, but what do you think? Don't you think that would be a better policy, Ms. King?
I think it probably would be. There would be a question, I think, in our minds about what it would cost to effect that transition and how long that would take and what would be involved with that. Yes. Because you'd have to, every living beneficiary and then new beneficiaries as they come on the rolls.
And we agree
new
with
ones
that.
Would be a lot easier. That wouldn't probably
Yes,
cost you much
would.
at all. But anyway. All right. I yield back my time, Mr. Chairman.